appropriate for Abby. I want to welcome everybody to our age-friendly quarterly education series. This is our third quarter installment, September 10th. So thank you for spending time with us today in senior oncology. I want to introduce our very own Abby Reigh. Abby is a board-certified pharmacotherapy specialist and clinical pharmacist in the Department of Supportive Oncology. She earned her Doctor of Pharmacy degree from the University of Pittsburgh School of Pharmacy. She completed her geriatric pharmacy residencies at St. Margaret Hospital in Pittsburgh. Dr. Reigh is deeply committed to enhancing patients' quality of life by managing symptoms such as pain, nausea, and fatigue related to cancer and its treatment. So we're very grateful, Dr. Reigh, that you're spending time with us today. And I just wanted to introduce everybody to our age-friendly education series. We're proud that we're an age-friendly Level 2 health system here at Levine Cancer Senior Oncology. And our 4M series covers quarterly the 4M framework of care, which you'll see here on this slide. And of course, today is medication. So welcome, Abby, and thank you for your time today.
Thank you so much. Happy to be here. So today's presentation is going to be about over-the-counter medication safety. So the title of today's presentation is Over-the-Counter Doesn't Mean Risk-Free. So some objectives for the end of today's presentation, you should be able to understand three basic differences between over-the-counter medications, prescription medications, and dietary supplements. You should be able to identify at least two risks or potential interactions associated with frequently used over-the-counter products, and recognize situations where over-the-counter medications may not be safe and may require discussion with a healthcare professional. I do not have any financial conflicts of interest to disclose. And just some disclaimers before I get started today. So this is general information only. So the content shared in this presentation is intended for educational purposes only and reflects some general principles of over-the-counter medication safety. This is not a substitute for individualized medical advice. This presentation does have an adult population focus, so the information presented will be specific to over-the-counter medication use in adults. Safety considerations may differ for children, adolescents, and even some older adult populations. And then other special populations that require extra attention, again, would be children, older adults, as well as individuals with multiple health conditions who may be more sensitive to over-the-counter medications. And just know that dosing and safety considerations can vary widely across patient populations. So prescriptions and over-the-counters and supplements, oh my, we hear these terms discussed all the time, and I think that we sometimes take for granted whether we fully understand or can appreciate the differences between these medications. So I wanted to just briefly talk about some similarities and differences between prescription medicines, over-the-counter medicines, and then dietary supplements. So the first one is probably the most obvious, that the difference between prescription and over-the-counter medications and dietary supplements is that prescription medications require a prescription by a doctor. Over-the-counter medicines, dietary supplements do not. The safety and efficacy of medicines is evaluated by the FDA for prescription and over-the-counter medicines only. So dietary supplements, things like vitamins, herbal products, are not assessed by the FDA. And then which of these can potentially be harmful if used inappropriately? all of them technically. So hopefully after today's presentation, you'll have a better understanding of some of the over-the-counter medication safety considerations specifically. So some common myths that I wanted to address in terms of over-the-counter medication safety. Over-the-counter medicines are not always safe. So just because you can buy a medication without a prescription does not always mean that it's safe. These medications do have labels on the back with very, very in-depth warnings and precautions about who may or may not be appropriate to take the medication. Over-the-counter medicines and vitamins can, just like prescription medications, cause side effects and can be harmful if used inappropriately. Natural does not mean risk-free. So herbal supplements, dietary supplements, things that are advertised as natural can still be dangerous. And they may not mix well with other medications. They may decrease how well other medications that you're taking work. And they also can just be generally unsafe in certain health problems, such as, liver problems, kidney functions, that type of thing. And last, your medication list should include everything you take. So when you're at the office and we're asking you which medications you're taking, that should include both prescriptions as well as anything that you're taking at home that is over the counter or a dietary supplement herbal medication. So definitely important, if you don't have already, to make a list of all of the medicines, vitamins, supplements you're used, regardless of whether they're prescribed, and continue to share this list, especially as things change, to help us help keep you safe. So I wanted the focus of today's presentation to be on some of the most common sections that we might see at an over-the-counter aisle. So if you're walking into a drugstore or a supermarket, these may be some of the banners that you're seeing around the aisle. That's usually across from the pharmacy. And this is not going to be an exhaustive review. Obviously, there are hundreds, probably thousands of products out there, so it would be impossible to go over all of them today. But hopefully after today's presentation, we will go over some of the most common medications, and you'll learn a bit about different considerations for all of these products. So the first section is pain relief. So many different medications in this section. So you have your oral medicines, so things like acetaminophen, aspirin, ibuprofen, and naproxen are the big oral, you can take them by mouth pills that we find over the counter. These other medicines listed here are the topical medications, so creams, patches, gels, sprays, even that you might find in the over-the-counter aisle. So we're going to kind of talk about these more in depth. So the first one is acetaminophen. This is a pain reliever or analgesic, as well as a fever reducer, or well, you may hear that called an antipyretic. So it helps decrease pain and helps decrease fevers. This medication can be unsafe for people who have decreased liver function. So if you have any type of liver-related health condition, it's always important to be checking with your doctor or pharmacist before you start a medication that contains acetaminophen. They may want you to avoid it, or they may have a maximum daily dose that they do not want you to take more of in order to protect your liver. For people who do not have any type of liver issues or dysfunction, the general recommendation is to not take more than 300 milligrams per day from all medications that contain acetaminophen. So as you'll see here on this chart, that is a number of medications over the counter. So you may be unaware that a certain product contains acetaminophen. So you can see on this list, obviously Tylenol is the brand name that is very well known for acetaminophen. But other things like Goodies powder is very popular. That also contains Tylenol. So if you're taking both of those medications together, those are both contributing to that 3,000 milligram max per day. Other common things that I see that people don't generally think of or might not be aware of, if you have a cold, and you're taking something like NyQuil or DayQuil or Mucinex, all of these products generally have Tylenol in them because it helps reduce fevers associated with certain types of viral illnesses. So if you're taking both NyQuil plus Tylenol because you have pain, make sure to be careful that you're not getting more than 300 milligrams of Tylenol from all different medications. The next set of medications that I wanted to address are the non-steroidal anti-inflammatory drugs, or NSAIDs. So these include aspirin, ibuprofen, and naproxen over the counter. There are other NSAIDs that are prescriptions as well, but these are the ones that are available over the counter. These are pain relievers, fever reducers, and as the name NSAID suggests, they help decrease inflammation. So in general, these are recommended to be avoided if you are taking any type of blood thinner or antiplatelet medication, things like Eliquis or Plavix or warfarin. All can increase risk of bleeding if you're taking those with any type of NSAID. These medications in general can put a lot of strain and stress on the heart and kidneys, especially with consistent regular use. So it's important to check with a doctor before you take these medications if you do have any type of heart or kidney conditions. Aspirin is another one that's commonly used. They have baby aspirin that people will use for heart protection. This is not recommended unless a doctor has specifically told you to do so, just because it can increase risk of bleeding. And aspirin should also not be used for pain relief in general because it has a much higher risk of bleeding compared to other nonsteroidal anti-inflammatory drugs. So common over-the-counter products that contain aspirin also include Goodies powder, Excedrin, migraine, or any other generic or store brand pill that's sold as a migraine relief medication. Common over-the-counter products that contain ibuprofen are things like Advil and Motrin, and naproxen is often marketed as a leave. Naprosyn is also another name, or Maxidol is another brand name that has naproxen. So we commonly see people don't realize that both Aleve and Advil are both nonsteroidal anti-inflammatory medications. So they are not recommended to be taken together. They can cause increased risk of bleeding, increased risk of heart and kidney damage, especially when you're using multiple different types of the NSAIDs. And then last one is just these topical medicines. So lidocaine is a local anesthetic that basically just helps numb the pain in the area that you apply it. Diclofenac is also an NSAID, but it is in a topical form over the counter. So it's a gel that can be applied to reduce pain and swelling in certain areas like joints. Capsaicin is actually an ingredient that's found in chili peppers and is used to kind of desensitize pain receptors. And then these three ingredients are commonly used. Camphor, menthol, and methyl salicylate are all what we call counter irritants. So they, when applied to the skin, cause a mild cooling or potentially even burning, tingling sensation that helps to distract from the pain that you're experiencing. And these are in a plethora of different over-the-counter products. It's very hard to list all of the different things, but topical medications like Bengay or BioFreeze are all some combination often of these different medications. Topical pain relievers are generally considered safer to use for most people because you're not taking them orally, so you're not getting a full body exposure to the medicine. Um, they can cause side effects. You can actually have absorption from the skin into the bloodstream if you are applying too much to a too large of a body area, or if you're applying them more frequently than is what is recommended. So just be cautious about that. They can cause skin irritation or allergic reactions in some people. So that's typically the most common side effect is just people having irritation from these products. They should not be used on any type of open wound, broken or irritated skin. This is because one, it can cause worsening irritation, but can also increase how much of that product is absorbed into the bloodstream. And then always wash hands after applying to avoid accidentally getting it into your eyes, mouth, or touching others. Next class, or I guess section of the over-the-counter aisle that I wanted to talk about is our sleep aids. So these are the three common sleep aids that we find over the counter. Diphenhydramine and doxylamine are both first generation antihistamines, and melatonin is a sleep hormone. So diphenhydramine and doxylamine, like I said, are first generation antihistamines. And that first generation just means that they were the first type of antihistamine to be developed. So they're older, and these actually cross into the brain tissue. So we have a blood-brain barrier that protects drugs that are in the bloodstream from entering into the brain. These medications can actually cross that barrier. These medications were created for management of allergy symptoms, but we've found that they have significant drowsiness as a side effect. So when we're using them for sleep aids, we are essentially using them for the side effects that they cause. Other side effects include confusion, dry mouth, blurry vision, urinary retention, and constipation. And because they do cross into the brain, these have a much higher risk of causing long-term side effects, including memory issues. They can cause people to feel unsteady on their feet, increasing risk of falls, and used long term for sleep, they've actually been shown to cause some dysregulation in the sleep wake cycle. So people end up using them for sleep long term. They can actually decrease your quality of sleep, leading to just a really vicious cycle of feeling like you need to take them more in order to fall asleep, but you're not getting high quality sleep, and you're actually increasing risk of a lot of these potentially very bad side effects, especially in older patients. Things like confusion, urinary retention, constipation can all be very, very severe in our older adults. So these are generally recommended to be avoided for sleep in most people, but particularly in older people. So like I said, not recommended in patients who are over the age of 65 due to increased sensitivity to the medication and higher risk of side effects. Over-the-counter products that contain diphenhydramine, again, this is a really sneaky one. There is diphenhydramine in a lot of products. So Benadryl is the most commonly known one. But even certain generic or store brand allergy relief products are actually just diphenhydramine. Things like Z-Quil are also just diphenhydramine, and then anything with PM in it, so the pain medicines like Tylenol, Advil, Excedrin that have PM generally have diphenhydramine in them as well. And then over-the-counter products that contain doxylamine include Unisom. um, Other sleep aid products that are generic may be either doxylamine or diphenhydramine. And then Z-Quil Ultra is another one. So again, kind of like what I discussed with Tylenol, it's really important to be aware of, you know, we want to try to limit these medications, avoid them as much as possible due to safety concerns. And it makes it even more difficult to do that when they are contained within so many different types of over the counter products. Melatonin is actually a hormone that the body naturally produces. So it's a sleep hormone. The melatonin that is sold over the counter is a synthetic form of that sleep hormone. Um, Normally, this is a hormone that helps to control the body's sleep wake cycle. So it kind of helps signal when it's your body's time to start preparing for sleep, especially in response to darkness. So this can help for people who are shift workers who maybe work night shift, but can also help for people who just in general struggle to fall asleep at night. This has a much lower risk of side effects compared to the antihistamines we just talked about, and it tends to be very well tolerated. There may be some stomach upset, maybe some drowsiness, but generally, pretty well tolerated. Definitely one that we prefer over things like diphenhydramine and doxylamine. And then just as an FYI, doses above 3 milligrams once a day do not provide any additional benefit. So you will see over the counter up to 10 milligrams being sold. And this, quite frankly, is just a waste of money. So you can save your money, just buy the 3 milligram dose. And that is totally fine and is what we recommend. So melatonin is generally sold as just generic melatonin, but there are some brand products that have melatonin in them, things like Ollie sleep gummies. Unisom also has a melatonin um, brand, so it's the Unisom Simple Slumbers. They market this as being drug-free because melatonin is technically a dietary supplement, not an over-the-counter medication. And then same thing with Z-Quil, they sell a melatonin sleep aid as well. All right, so then moving on to allergies and sinus congestions, antihistamines are also a very big component of this aisle. So there are two different types, as I alluded to earlier. We already talked about the first generation antihistamines. Then we have our newer second generation antihistamines as well. So just a refresher, the diphenhydramine, the active ingredient in Benadryl, was originally developed for allergy symptoms. So this medication works by blocking the effects of histamine, which is a chemical that your body releases in response to an allergic reaction. And this release of histamine is what causes those reaction allergy reaction, things like sneezing, itching, runny nose, cough. So as an antihistamine, diphenhydramine blocks this effect, reducing things like sneezing, itching, and runny nose. Um, like we mentioned already, this is a first generation antihistamine. It does cross into the brain tissue, which causes increased risk of side effects associated with the brain, things like confusion, memory impairment, balance, and and therefore has a higher risk of side effects, including the confusion, drowsiness, as well as dry mouth and blurry vision that we talked about. Already mentioned long term, this can lead to memory issues, falls, decreased sleep quality, and again is not recommended in patients over the age of 65. So again, just some common products that contain diphenhydramine are Benadryl, Banafin, those allergy relief medications, and then anything labeled as PM. Excuse me. So our second generation antihistamines are things like levocetirizine, cetirizine, loratadine, and fexofenadine. These are the newer antihistamines. They do not cross into the brain tissue and therefore have a lower risk of side effects. So these are generally what we prefer for people who have things like seasonal allergies or pet allergies and need to take a daily or as needed allergy medication. Again, these work the same way, blocking the effects of histamine and preventing those allergy reactions. They have the lower risk of side effects and therefore are our preferred option. Products that you might recognize that contains tyrosine or Zyrtec and Zyrtec D. Loratadine is under the brand name Claritin. Fexofenadine is sold under the brand name of Allegra, and levocetirizine is sold under the brand name of Xyzal. There are also topical or like nasal sprays. Technically, it's a topical because you're spraying it into the nose. But there are three different types that are available over the counter. First being nasal decongestants. So these are things like phenylephrine and oxymetazoline. So you may see brands like Afrin or just generic sinus congestion relief sprays. Nasal antihistamines are isolastine and olopatadine. So things like Pataday are the brand that you might see. And then nasal corticosteroids are things like fluticasone or Flonase or mometasone. I'm not going to talk about these in too much detail, just because these are generally pretty safe and well tolerated. They may cause nosebleeds with incorrect use, so it's always important to just make sure that you're reading the directions on how to properly apply that spray into the nose. And then specifically the decongestants, so phenylephrine and oxymetazoline, should not be used for more than 3 days because they may actually worsen sinus congestion over time. And this can cause damage to the cells that line the nasal passage and actually cause just worsening congestion that is very difficult to get rid of. All right, moving into the cold and flu section. So we have, again, kind of three different classes of medications that you will commonly find in the cold and flu aisle. So our first one is dextromethorphan. That is a cough suppressant. We have two decongestants that are actually pill forms. So we just talked about the nasal decongestants that are sprays. They also make them in a pill form. So phenylephrine is one that is available over the counter. Pseudoephedrine is one that is also available over the counter, but it is behind the pharmacy counter. So you have to be at least 18 years of age to purchase this from the pharmacy, and you do have to show ID. And there are quantity limits for how much of this you can buy within a certain time period. The last one is guaifenesin, which is an expectorant. So we'll talk about these in more detail. So dextromethorphan works as a cough suppressant by basically targeting the cough center of the brain and just suppressing the urge to cough. So in general, this should not be used for a cough that's lasting longer than 7 days. Anything that's lasting longer than 7 days should generally be evaluated by a doctor. And it's also not recommended to use this for what we would call like a wet cough. So when you have kind of phlegm or mucus, using that cough suppressant can actually prevent the body from coughing, which is the natural reaction to try to clear out that gunk, for lack of a better word. These should not be taken in combination with a specific type of antidepressant called monoamine oxidase inhibitor drugs. They're pretty uncommon, but there are still patients that take them. So if you are taking any type of antidepressant medicine and you're not sure which type you're taking, always important to double check with your doctor due to an increased risk of a serious life-threatening syndrome that can occur with this combination. In general, this dextromethorphan can increase the risk of side effects, including drowsiness, sedation in people who take medications for sleep, pain, mood, or anxiety. So it's always important to use this cautiously if you're on any other kind of medication that can also cause drowsiness. So over-the-counter products that you might be familiar with that include dextromethorphan, it's basically anything that ends with DM. So the DM stands for dextromethorphan. Products like Mucinex DM, Robitussin DM, Tylenol cold and flu has this, as well as Delsum and NyQuil as well. Decongestants are work basically to restrict the blood vessels. So when you're sick, these blood vessels kind of swell and cause these secretions, nasal drip, and mucus. So it just helps kind of reduce the swelling in the nose to help air move more freely, to help the mucus kind of clear more freely. Um, it also does restrict blood vessels in other areas of the body, though, because you're taking it orally, it's going to work everywhere, not just in the nasal passages. So this can lead to high blood pressure and even heart palpitations. So decongestants are not recommended to be used in people with any type of heart condition unless they've already talked to their doctor about it. Coricidin is a brand name for another medication that is generally targeted or recommended for people with heart conditions who cannot use the decongestants. However, this also contains basically just acetaminophen and chlorpheniramine, which is also a first generation antihistamine. So while you are reducing the risk of any type of heart-related adverse effect from avoiding decongestant, you're also introducing a first generation antihistamine, which we already talked about causes that drowsiness, confusion, falls. So generally not a much better alternative, unfortunately. So I do generally recommend people avoid this unless they talk to their doctor about it first. Products that contain phenylephrine, anything with PE is phenylephrine. So Sudafed PE, certain generic sinus relief products may have phenylephrine in them, as well as both Dayquil and NyQuil. Over-the-counter products that contain the pseudoephedrine. So again, these are things that are only available behind the pharmacy counter, but can be purchased if you are 18 years of age or older, is anything with just D. So Sudafed, Mucinex D, NyQuil D, Zyrtec Claritin D are all medicines that contain pseudoephedrine. These products act very similarly. So another common thing is, people will take both Dayquil and Sudafed, not realizing that they're taking two different decongestant medications. So it's important to understand that both of these work similarly. And if you are taking a decongestant, just be very cautious not to be accidentally combining them with using multiple different cough and cold products. And then the last one is the guaifenesin. So this is the expectorant. It works by helping the cells that line the respiratory tract secrete more water. So it just helps to thin any type of mucus or phlegm that you have, making it easier for you to cough it up. It's generally pretty well tolerated. There's very few side effects as well as no known drug interactions. So this is a good option for people who have cough and cold where they just have a persistent kind of crackling or wet cough and they just need a little bit of help coughing up that mucus or phlegm. So over-the-counter products that contain guaifenesin are just kind of generic store brand mucus relief is often what they will say on the packaging. Mucinex and then Mucinex DM, Robitussin DM, Delsym DM are also all of the ones that contain both the guaifenesin, so the expectorant, as well as dextromethorphan that we already talked about, which is the cough suppressant. So I think this is a funny thing that pharmacists just really gripe about, where it really doesn't make sense to have something that is functioning to help promote coughing up mucus and then combining it with dextromethorphan, which suppresses cough. So generally, I don't recommend any product that has DM just because it doesn't really make sense. The two actions kind of cancel each other out. So if you are choosing a product, the guaifenesin is good to be using during the day when you're trying to thin that mucus, cough as much as you can. And then if you are having issues sleeping at night because of a persistent cough that's keeping you awake, you can consider using something like dextromethorphan to help suppress that cough just for the nighttime only to help you sleep. And then other cold and flu medicines also contain these pain reliever, fever reducers, things like acetaminophen and ibuprofen. So I'm not going to break those down. We already talked about those in depth, but just again, being aware that there is a lot of overlap in ingredients between all of these different medicines. So it's really, really, really important to read that label of what it is that's actually contained in the product. And then same thing with the first generation antihistamines. A lot of the things like NyQuil, cold things that are targeted for sleep, contain diphenhydramine or doxylamine that we know can be dangerous, especially when used more regularly. All right, and then the last one that I just wanted to briefly touch on is dietary supplements. So there was actually another presentation that I have linked at the end of this PowerPoint today that another pharmacist within the system, Dr. Pellegrino, did that was excellent. That is a very in-depth breakdown of dietary supplements. So I have that at the end of the presentation if you are looking for more information. But in general, vitamins, supplements, and herbal products are not regulated by the FDA. We already talked about this. This means that the companies who make these products and are selling them don't have to prove that they are safe or effective before selling. They're basically regulated like foods. So obviously, if a company knows that they are harmful, they cannot be sold. But if they're not studied and we maybe don't know if there's harm, these generally tend to be more after the fact recalls that happen if they are found to be harmful. So we definitely recommend using these very cautiously. They are not intended to diagnose, treat, cure, or prevent any disease. So because there's no research studies required for these products, companies are not legally allowed to make any claims because they would be false about their supplement treating, preventing, or curing any type of disease. So just be very cautious and you should use yeah, be a little bit skeptical for sure if you're seeing anything that's being sold online or being talked about online by people who are, advertising it or claiming that it cured, treated something, because we just don't know this is true. Supplements are generally marketed as more ethical or natural. This is a big thing. There's a huge shift in focusing on natural products. And I think a lot of this is because of growing mistrust in large pharmaceutical corporations that are very profitable. So I think the supplement companies generally use this as a way to steer people towards their products by advertising them as more natural alternatives to traditional medicines. However, I think it's just really important to recognize that many of these supplement companies are highly, highly profitable. What I found researching this was that the estimated revenue or annual earnings for the entire wellness and supplement industry within the last year was about $200 billion. So it's still a huge industry and it is growing very, very rapidly as well because of this marketing that is trying to steer people towards more natural products. And then I think the last thing is most people maybe don't realize that in the United States, most of our foods are already fortified or enriched with the necessary vitamins and minerals. So in general, if you are eating a diet that is, has protein, grains, fruits, and vegetables, our foods are already enriched or fortified with the necessary vitamins and minerals that the human needs, per our recommended daily intake. So, in examples of foods that are enriched in our country are grains and cereals that are enriched with iron and B vitamins. Flour and bread is fortified with iron and folic acid. And then milk and dairy products are fortified with vitamin D and other trace minerals. So, in general, if you're eating, a very well balanced diet, most people don't need a general multivitamin to get these um, vitamins. They can be obtained through diet alone. So just some select dietary supplement interaction side effects I wanted to just briefly mention for today. Again, this is non-exhaustive. There are many, many, many supplements out there, so it's always really important to check first with your doctor before you take anything. But St. John's wort is something that is sold to help manage mood or anxiety. This interacts with many medications, including antidepressants, blood thinners, oral contraception or birth control, as well as many cancer treatments. And it can also be harmful to the liver. So we do not recommend ever taking St. John's wort just due to those side effects and drug interactions. The G's are one that we recommend being aware of if you take any type of blood thinner or antiplatelet medication, as well as the NSAID drugs, because all of these ginseng, garlic, ginger, and ginkgo biloba can increase the risk of bleeding when they are used in combination with blood thinners, antiplatelet medications, and NSAIDs, including baby aspirin. And then ashwagandha is another one that's pretty popular. This can increase risk of side effects and sedation for people who already take sleep, pain, mood, or anxiety medications. So this can cause, added side effects when combined with medicines you might already take, and can also interact with diabetes and thyroid medicine. So we just recommend, being cautious and asking before you start anything like this. So, to wrap up, just some general tips for safe medication use. Always read the label carefully. So, every over the counter medication that's regulated by the FDA, right? That's what we established is over the counter, will have a drug facts on the back of it. So, it'll be either on the box or the bottle, depending on what you're purchasing. And this shows specific uses, warnings, or people who should avoid taking this medication. So it is generally a very tiny, tiny font. So you might need glasses, magnifying glass, but this does serve a very important purpose, and people generally don't read this. So, and this also has the recommended daily dose. So it tells you based on potentially age or weight, the maximum amount of this product that you should take. So if we zoom in, you can see there's the warnings section where it talks about certain allergies. If you have, there's a stomach bleed warning, heart attack and stroke warning. It has a list of people who should not use this. And then when you should ask your doctor before taking this. So definitely make sure to read this prior to starting anything new. And then I just wanted to point this out. This was actually something I found online. Um, a lot of the bottles nowadays, because they have so many warnings, they actually have the little peel here. So you actually have to peel it back to see that there's more drug facts. So always make sure you're reading it in its entirety. This back, as you can see, this was actually a naproxen bottle that I found the picture of, but it has even more information about, you know, when to stop using this product if you have any kind of side effects. So definitely really important information can be found right on the bottle. Watching for duplicate ingredients. I know I've talked about this a lot throughout this presentation, so hopefully that's clear. You know, a lot of different products contain the same or similar ingredients, which can lead to taking too much. So all of these medications contain doxylamine. So what we don't want is someone who's taking Unisom for sleep and then they also have a cold and they're taking something like Mucinex Fast Max, because you're going to be getting too much doxylamine. Another example is these are all medications that contain acetaminophen. So, you know, you're taking goody powder for just general aches and pains, but then you also get a migraine, so you take an Excedrin, and then you realize that your migraine's because you have a cold and you're taking NyQuil. This can very, very easily all add up to being way too much Tylenol. And then just as a fun fact, these two also contain aspirin. So much of the over-the-counter products are just a combination of so many different drug products, and it's really, really important to just be very aware of what ingredients are actually in the brand name that you're taking. As always, ask your pharmacist or doctor if you're not sure before taking something new. And then, like I said earlier, keeping that medication list. We want to know all of the medicines that you're taking, even if it's just something you picked up at the drugstore last week. If it's something that you take even here and there, we want to know about it just to make sure that there's no potential interactions with any of your other medicines or treatments. And then where you can learn more, you can ask to speak with your Levine cancer pharmacist. I've linked a couple helpful videos that are also on our Atrium Health Levine Cancer Supportive Oncology YouTube channel. So I have the general link to our YouTube channel, as well as related videos to this topic. So Dr. Pellegrino's video on navigating supplements, vitamins, and herbals, as well as another presentation that I've done in the past about use of off-label medications. These are my references, and that concludes today's presentation. What questions can I answer today?
Thank you so much, Abby. I always learn something with your presentations, no matter what year. So thank you for sharing with us today. And the other thing I wanted to mention is I often have to tell family members and patients that a lot of over-the-counter medications started out as prescription medications, right? And even though the dosage might be lower, you know, they were prescriptions sometimes at one time. So again, reason for caution there. So does anybody have a question they'd like to unmute and ask or put in the chat? I don't think we have any so far. That was very thorough, and again, we appreciate you spending time with us. This is recorded. It will be on our channel for Department of Supportive Oncology. And our next fourth quarter series is December 10th and will be related to what matters most for our age-friendly series. So Abby, thank you again for spending time with us today. And we appreciate you.
Thank you. Thank you so much, everyone.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.